What is the number one cause of end-stage renal disease that's never tested for? Just about never tested for. You get patients with complete renal failure of a sudden nature, and they don't even test for it. And why don't they test for it? It's high homocysteine, hyperhomocysteinuria or homocystinuria, the number one cause of end-stage renal disease in the world. It's hard to imagine they don't test for it. I see patients regularly with this problem. They're going on dialysis or almost to dialysis because their homocysteine is through the roof. Homocysteine, when it goes through the roof, causes release of two cytokines, IL-8, interleukin 8, and monocyte chemoprotectant 1, MCP-1. The reason they don't test for it is because there's no treatment for it, at least none they know of. They ought to read the literature, read some books, watch some TikTok videos, do something, because there's lots of information out there. A validated functional glutathione would and should and does cause monocytes not to release those cytokines. So homocysteine does not affect you directly, it affects you indirectly by causing white blood cells or monocytes to release those two cytokines, IL-8 and MCP-1. They're the things that do the damage. They're the things that cause the high blood pressure, the kidney disease, the end-stage renal disease, the dialysis, and everything else. It's a nightmare that you can't get rid of because no one knows how to treat it. Homocysteine and glutathione are two sides of the same coin. You've seen me do this before, but I mean it really and truthfully. They're the opposites of each other. Homocysteine is evil, it's bad, it's inflammatory, it causes high blood pressure, it ruins your life, it will kill you. Not always, but mostly. In several bad ways, it even causes blindness, retinopathy, all kinds of weird neurological disorders. It's just a bad thing to have. Go to PubMed, look at it. Glutathione stabilizes monocytes and prevents the release of MCP-1 and IL-8, the cytokines. Take a validated functional glutathione and you can not only lower your IL-8, you should get it below 3. You can check that level and see what it is. You cannot lower your homocysteine. It's not possible when it's high and fixed in place. You've got to live with it, but you don't have to have any problems from it if you take enough functional glutathione. VARS Glutathione, because it stands for validated, absorbable, reduced stable glutathione. It's ours, it's mine, and you take it in capsule form. You need to try that and see if you can lower your IL-8 level below 3. You might need 4 or 5 a day, you might need 2 a day. This is Dr. Dan Purser, just giving you some new ideas on therapies that work.